Hello everyone and welcome back to the channel. Today we shall be discussing about clozapine, which is one of the most effective but also the most closely monitored medications used in modern day psychiatry. So many patients and nurses in mental health find clozapine intimidating because of its strict monitoring requirements, potentially serious adverse effects, and extensive physical health assessment that needs to be carried out before commencing this medication. So, however, once you understand this medication, how it works, what to monitor, and how to keep your patient safe, managing patients on clozapine becomes much more straightforward. So our learning objectives. So by the end of this lecture, you should be able to understand what clozapine is, how it works, why it is considered gold standard for treatment-resistant schizophrenia. You should also be able to understand the indications and contraindications of these medications, the baseline investigations that needs to be carried out prior to commencing a patient on clozapine. You should also be able to understand the blood monitoring schedule for patients that are already receiving this medication. Most importantly, you should also be able to understand the side effects that a patient can experience when he's on this medication. You should also be able to understand the red flag symptoms, nurses' responsibilities, and also the signs of clozapine toxicity. So what is clozapine? So clozapine is classed as atypical or second generation antipsychotics. So unlike many antipsychotics, clozapine is specially reserved for patients whose symptoms have not responded adequately to other treatments because it carries significant risks that requires regular monitoring. So despite these risks, clozapine remains the most effective medication for treatment-resistant schizophrenia, and it is often life-changing for patients who have not benefited from other antipsychotics. So how does clozapine work? So unlike our regular typical antipsychotics that have a strong effect on dopamine receptors, clozapine have a broader pharmacological profile. So clozapine acts mainly on several neurotransmitters. These include dopamine receptors, serotonin receptor, histamine receptor, muscarinic receptor, and alpha-adrenergic receptor. So it is these broad receptor activities that contribute to its effectiveness and also explains why it has a wide range of side effects. So what makes clozapine so unique? This is because it is the only medication that is licensed specifically for treatment-resistant schizophrenia. It significantly reduces suicidal behavior in patients with schizophrenia. It also causes fewer extrapyramidal side effects unlike other antipsychotics. However, it requires long-term monitoring and blood work because of its risk of agranulocytosis. So now we shall be discussing about the indications of clozapine. So the major indication of clozapine is for the management of treatment-resistant schizophrenia. So in this situation, clozapine is typically used when a patient's schizophrenic symptoms do not improve despite taking adequate doses of at least two different antipsychotics, of which one of these antipsychotics must be an atypical antipsychotic. Additionally, it is also indicated to reduce suicidal risks in patients with schizophrenia, and is also used in Parkinson-induced psychosis. However, when clozapine is being used for this indication, it must be under specialist investigation and at a lower dose. So now we shall be discussing about the contraindications of clozapine. Firstly, clozapine should not be used in patients with previous agranulocytosis or severe neutropenia. This is because clozapine can cause agranulocytosis, a potentially life-threatening reduction in the number of neutrophils. As we all know, neutrophil is essential white blood cell that is responsible for fighting infection. So if a patient has previously developed clozapine-induced agranulocytosis or severe neutropenia, re-exposing the patient to this medication can increase the risk of reoccurrence, and this can lead to overwhelming infection, sepsis, or even death. Secondly, patients with bone marrow disorder should not be introduced to clozapine. This is because the bone marrow, as we all know, is responsible for the production of blood cells These include the white blood cell, the red blood cell, and also platelets. So patients with existing bone marrow disorder already have impaired blood cell production. So because clozapine is known to suppress bone marrow function, treatment may lead to dangerously low blood cell count, which will increase the risk of serious infection, anemia, and other bleeding complications. Thirdly, patients with uncontrolled epilepsy should not be introduced to clozapine. So this is because clozapine lowers seizure threshold in a dose-dependent manner. So what this means simply is that the risk of developing clozapine-induced seizures directly increases with higher dosage and elevated plasma level, thus making seizure more likely. As we all know, patients with uncontrolled epilepsy are already at increased risk of seizure, and clozapine may further increase seizure frequency or severity, potentially resulting in prolonged seizure or status epilepticus. Fourthly, patients with paralytic ileus should not be introduced to clozapine. This is because clozapine has significant anticholinergic effects that reduces gastrointestinal motility. So in patients with paralytic ileus, where the bowel has already stopped moving as normal, clozapine can worsen bowel paralysis, increasing the risk of bowel obstruction, bowel perforation, sepsis, or even death. Number 5, patient that is already hypersensitive to clozapine should not be exposed to these medications because they can have dangerous adverse reaction. So some signs of hypersensitivity can include rash, urticaria, facial or tongue swelling, wheezing, difficulty in breathing, and also anaphylaxis. So why do we check white blood cells regularly for patients that are receiving clozapine? So this is one of the most important aspects of clozapine treatment. Clozapine can suppress bone marrow function. This reduces the level of neutrophil in the system, and neutrophil helps in fighting bacterial infection. So severe neutropenia increases the risk of overwhelming infection. So this is why regular blood monitoring is mandatory for patients that are receiving clozapine. So the blood monitoring schedule for patients that are receiving clozapine is pretty straightforward. Firstly, you monitor blood weekly blood test is indicated for the first 18 weeks. Then after the first 18 weeks, you monitor it every 2 weekly from 19th week up to 1 year. Then after which you continue, the monitoring frequency changes to monthly after 1 year if the result of clozapine, if clozapine level in the blood remains stable. So if blood result becomes abnormal, monitoring frequency can also increase, or clozapine may need to be stopped immediately depending on the severity. In terms of monitoring of clozapine, some facilities also adopt a traffic light system. As we all know, the traffic light has the green, amber, and the red. So many clozapine monitoring service uses this traffic light system. So the green means blood cell count is acceptable and there is no concern, so the patient can continue receiving clozapine. However, when blood level states amber, it indicates that caution needs to be applied and the patient needs to be monitored more closely. However, when clozapine blood comes back and is red, so this means that clozapine must be stopped immediately and urgent review is required. However, it is important for nurses to always follow their local clozapine monitoring services and their organizational policies because not all organization uses this traffic light system. So when a patient is being titrated on clozapine, this must be started slowly because rapid dose increase can increase the risk of hypotension, collapse, respiratory depression, and also cardiac complications. So the initial dose is usually 12.5 milligram, which can be in divided dose or just one dose in a day. Then this is increased gradually under supervision until an effective therapeutic dose is reached. Sometimes a patient can be prescribed up to 900 milligram per day. Common side effects that are usually experienced when a patient is on clozapine include sedation, weight gain, hypersalivation, constipation, tachycardia, orthostatic hypotension, dizziness, dry mouth, blurred vision, increased appetite. So some serious side effects that a patient can experience when they are receiving clozapine include agranulocytosis, neutropenia, myocarditis. So patient on clozapine, the risk of developing myocarditis is usually highest during the first month of receiving this medication. So, as a nurse, you need to watch out closely when a patient complains of chest pain, shortness of breath, palpitation, tachycardia, and even fever. Also, when a patient makes all these complaints, you should also carry out blood investigation, and you can also when blood investigation is being carried out, you might also discover that there is raised troponin or CRP. Also, cardiomyopathy is one of the serious side effects. Seizure, as we discussed earlier, aspiration pneumonia, and severe constipation. So when a patient is on clozapine, his bowel movement needs to be monitored closely because of the risk of severe constipation, and we usually use Bristol's 2 chart in monitoring this. Also, paralytic ileus can also develop, and also bowel obstruction, venous thromboembolism, and also neuroleptic malignant syndrome can also develop when a patient is receiving clozapine, although this can occur in rare cases. So the nurse plays a vital role in ensuring safe clozapine therapy. So the responsibilities of nurses include confirming that blood monitoring requirement has been met before administering this medication. The nurse also needs to be monitoring the vital signs of the patient, continue to assess mental state of patients so as to evaluate the effectiveness of this medication. You also need to monitor bowel function of a patient, assess the hydration status of this patient, and also carry out other physical health monitoring. This include the height, weight, blood glucose if indicated. Also, you can offer lifestyle advices when patient is receiving this medication. And also, when a patient is on clozapine, you also need to monitor patient closely for signs of infection. So there is an acronym called fever when monitoring for sign of infection. So F stands for fever or chill, E stands for exhaustion or feeling generally unwell, V stands for when a patient is voicing sore throat, E is overt evidence of infection. This includes mouth ulcer, burning pain when urinating, or skin redness. Then R means you should report immediately and arrange for urgent FBC for this patient. Also, you need to support medication adherence for this patient and provide physical health education. After administering this medication, you also need to document accurately and also escalate any concern promptly to the MDT. Then secondly, if a patient misses a dose of clozapine, what happens? So usually when the patient misses this medication for over 48 hours, this medication is usually restarted this medication is usually retitrated, so it is not advisable for patients to continue on their current dosage because this can lead to potentially serious adverse side effects. So smoking is one of the most clinically important considerations for a patient that is receiving clozapine. This is because cigarette smoking increases clozapine metabolism and also lowers blood level. So if a patient stops smoking suddenly, clozapine levels can rise significantly in the system. This increases the risk of toxicity. Also, restarting smoking can reduce clozapine level and increase the risk of patient relapse because the level of clozapine in the system will actually reduce. So changes in smoking habits should always be reported promptly so that the prescribing team can review the medication and establish a better dosage for the patient. Also, you need to monitor for signs of clozapine toxicity. So as a nurse and as a patient receiving clozapine, you need to watch out for excessive drowsiness, confusion, hypersalivation, akathisia, slurred speech, seizure, hypotension, and also tachycardia, and also reduced level of consciousness. So thank you so much for listening and watching this presentation. If you find it useful, kindly like, share, and drop your comment on the comment section. Thank you.